favoured physicians.
I've been called an axeman and all different things, and I've had death threats, and I've had a whole lot of other threats throughout the time.
Dunedin neurologist Dr Victor Duplessis says being a medical assessor for ACC has sometimes put him in the firing line. So you've been targeted?
I'm being targeted, yes, I am.
I guess the argument is you do a lot of work for ACC.
I do a lot, yeah.
And that you are one of their favoured assessors.
Well,
because
I don't know about that, but yes, I'll accept what you say.
You are writing the reports that enable ACC to take people off claim, which is why you are referred to as the hatchet man.
Well, you see, that is also a perception of a few people. They have no idea how many of the reports I sent to ACC in which I have pointed out to them mistakes that had been made, that the patients actually require further treatment and what their treatment should consist of. Those people are not the ones who complain. It's only the ones who feel that they've been done in, but they have difficulty taking it out on ACC, and they'll then go for the doctor.
So the money you're being paid, I mean, that information has been released under the Official Information Act. I mean, what do you think about that?
Well, I think it's invasion of my privacy. Firstly, I don't steal the money, and secondly, I work hard for it. And I don't see what it has to do with what I write. It's got nothing to do with the contents of the report.
Like anyone paid from the public purse, Dr Duplessis' salary is open to scrutiny. In the last 2 years, ACC has paid him between $400,000 and $500,000 per year. And in the last 5 years, his total pay from ACC was between $1.7 million and just over $2 million.
I work for it. I don't get it for nothing. I'm not sitting with a claimed injury and getting an income every week. I work hard for it. I work probably in excess of 70 hours a week, and I've been doing that for my entire working life. And I work hard.
There is little doubt Dr Duplessis works hard. His regular job as a neurologist is at a rehab unit and Dunedin Hospital, working 32 hours plus a week. On top of that, every evening and weekend he spends doing ACC assessment reports, as well as travelling to see claimants.
At the moment I am away probably 2 days, Friday, Saturday, every second week.
So you don't just see people in Otago and Southland?
No. No, I see patients throughout New Zealand.
As a specialist assessor for ACC, you obviously see a lot of claimants. Of those, how many people do you think should be on ACC?
I still think taking the numbers, the majority still requires some support in some fashion from ACC. But the degree of support is variable because, you know, if you've had a bad injury, it doesn't mean that you can't do nothing. You can always go back and do something because it's also part of rehabilitation to do things. So I don't think more than probably 1 in 5 of the patients probably not even that, maybe 1 in 10 of the patients I see, I would say that they definitely should not be on ACC and shouldn't have been on ACC.
What about people that you see that are on full compensation and you think perhaps they should get partial compensation?
Probably 2 or 3 out of 10.
So we're looking at 4 people out of 10 who are getting ACC where you think maybe they shouldn't be getting...
Or not as much as they're getting.
Not as much as they're getting.
Yeah. You know, there is a perception out there that every patient who sees me gets knocked off ACC compensation. The first thing is I don't have any say in that particular matter. I don't advise ACC in that regard. I write my report, I answer the questions they put as honestly as I can, and I believe I'm being totally honest when I do the answering of the questions. I've always prided myself on being totally independent, and I've never ever accepted a preferential supplier status from ACC.
It is impossible to find out exactly what percentage of claimants have lost their ACC entitlements following or involving an assessment with Dr. du Plessis, or any other doctor for that matter, because ACC does not record that information. Some specialists involved in brain injury rehab are critical of ACC's use of Dr. du Plessis as an assessor because of the tough stance he takes on what's known as mild traumatic brain injuries.
To get a person who's had a very mild head injury, having ongoing problems 10, 15, 20 years after the injury is not medically correct. And
is that just according to you?
No. I've got piles and piles of literature which I can show you, which actually states that if you had a mild head injury, then you should recover, and some say is in as little time as 2 to 3 weeks fully, others say within 3 months, and if you don't recover, this is related either to psychological, psychosocial, or non-traumatic brain injury factors. So it's other factors.
But it's not that black and white, according to other brain injury specialists, who say many, but not all, people recover from mild traumatic brain injuries. You must know there are specialists in New Zealand who totally disagree with you.
Yes, I do. There are people, but then they must look what the world literature says. And the latest literature states that patients with mild head injuries get better.
There are cases, and some have gone to court, which clearly shows that your view is very different from other specialists who may have treated ACC claimants for years.
Yeah, I accept that, but I've also got several court reports where the judges have praised me for my thoroughness and reviewing all the documentation and given me the credit for what I think I should have got for those cases.
But equally, I've read court documents where the judge has agreed that your opinion is out of step with all the other medical opinions on file.
Well, this is where I said I think it's important that these cases actually go to court.
That was in court?
Yes, but where the doctor gives evidence. I was never asked to give evidence in those cases.
But there are some cases where they say you haven't got it right in court?
I've not read any of the reports. I've got a few sent to me every now and then, and which have been pointed out that the judge didn't accept what I said. As I said, I would love to have stood up in court and given my evidence.
I want to put it to you again that the criticism of you is that you're getting paid hundreds of thousands of dollars and you are one of a group of assessors that is convenient for ACC to use because you give them the result that they need.
Well, that may be true, it may not be true. It may also reflect on the incompetence of other doctors who are doing assessments and not doing them properly.
Because what is apparent is that your view is often different from the other specialists.
Yeah, I accept that.
Why do you think they're flying you all over the country to do assessments when there are other specialists in these areas who could do them?
They must ask ACC. I've got nothing to do with that. I've never asked to be flown anywhere. I've been invited by ACC to see patients in other areas, and ACC must explain why they want me to see it.
Coming up.
So you fly neurologists, for example, to Auckland. Here's a list of the neurologists in Auckland.
No, sorry, I don't have my glasses with me.
That's next on 60 Minutes. Of course, Melanie Reid wanted to hear the ACC side of the story. Has it been doctor shopping? Does it just want assessors who'll recommend clients get back to work? So many questions. But getting all the answers wasn't totally straightforward.
ACC had a strategy to reduce long-term claimants. What was that strategy?
Well, the strategy around helping people rehabilitate and recover will necessarily mean that over time we'll have less long-term claimants, which is a good thing.
The allegation is that ACC have hijacked the words rehabilitation, recover, independence, and what you were running was nothing more than an exit program.
Well, you can use the word exit. I would bring us back to the point of ACC, which is to facilitate the recovery of people who have been injured. And
but
that's the
my
role.
question to you is, the allegation is that this is nothing more than an exit program. Now, this interview is not a public relations exercise, it's an interview.
Well, I came here today to talk about clinical issues. You know that I'm a doctor, and that's what I can answer for you. I can't answer those allegations.
For 10 days, with all due respect, Doctor, I've been trying to get an interview with ACC. You are the man that they've put up. Now, when ACC finally fronted for an interview with their Acting Director of Clinical Services, Dr. Peter Jansen, we were allocated just 15 minutes. In 2010, the former ACC Minister and the ACC Chairman, they signed a 3-year deal which was to get rid of 1,150 clients a year off the long-term claim pool.
That helps, those type of targets help ACC staff, all the ACC staff, focus on our role.
ACC talks about positively managing long-term ACC clients. Their own graph shows just how positive it is. Since 2009, the numbers in the long-term claim pool have dropped by thousands, the lowest it's been for nearly 2 decades. Long-term claimants are under the Recovery and Independence Service.
The Recover Independent Service, yes.
Now, your own staff, they say that their sole job was to exit people off that long-term claim pool.
Exit means that people do not require our support anymore. They are now independent.
Why are so many of them going to review and having their cases overturned?
Well, people are entitled to go to review if they feel dissatisfied with a decision by ACC, and I would encourage people who are dissatisfied to think about contacting us.
I know.
Lawyer Phil Schmidt spends most of his working days preparing for or attending those independent review hearings, representing claimants in dispute with ACC. So far this year, ACC has lost nearly 50% of all cases that have gone to independent review. A statistic, Phil Schmidt says, speaks volumes.
The quality of decision making is poor. The fact that so many decisions are successfully challenged at review and appeal is ample illustration that they are poor. There's no way that that claimants should be successful in the number of appeals they are being successful. And that is the tip of the iceberg. That error rate is... what that means is that there are thousands of people who are being passed fit for work who cannot work.
Earlier we revealed just how much some of the selected assessors are being paid by ACC. One of these doctors, for example, was paid between $800,000 and $900,000 in just 1 year. And all of them saw hundreds of ACC claimants. In 2009, ACC changed the rules. Claimants used to have a choice of assessor. It is now being dictated to them who they can and cannot see.
When we engage in assessment of a person who is injured for many different reasons, we follow the directives of the courts and of course ACC policy.
Which you make. ACC makes its own policy.
We make policy and we are bound by what the courts tell us as well.
The criticism is that ACC is determining everything, and now they're determining the assessors, and that the assessors are the gateway to entitlement, and if ACC chooses the assessor, you have more control over the outcome.
Well, that's an allegation, but let's go back to the purpose of assessment. It's undertaken for a lot of different reasons. We need to understand, for example, what are the injuries that the person has. We need to understand what our role is in mitigating those injuries or helping the person recover. So we'll need expert assessors.
Why are you flying doctors around the country to do assessments when there are equally qualified specialists in areas that you are sending them to?
I think that's the point. Sometimes there isn't geographical coverage. We don't have expert assessors in all parts of the country for all of those things that I've just mentioned: medical, clinical, occupational therapy, housing, other types of assessments. Those that choose to take contracts with ACC are a smaller pool again, So at times we will have to fly assessors around. Assessors may not be available. They might be at a conference or undergoing further training in